Hi everyone, thank you for coming to the CD Capacity Building Team Education session. So today we have Dr. Michael Emlung, who will be talking about internet gaming addiction, and Lana Veladego, who will be presenting on hypersexual addictions. A reminder that some people will be joining us remotely, so if you have any questions or comments at the end of the session, just raise your hand and I'll bring you the mic so they'll be able to hear you. So Dr. Michael Emlung is an assistant professor in the Department of Psychiatry and Behavioral Neurosciences at McMaster and a researcher in the Peter Bohr Center for Addictions Research at St. Joe's, Hamilton West 5th. He is also a research psychologist with the Concurrent Disorders Program at St. Joe's, where he provides support for research and quality improvement in the program. Dr. Emlung and his students conduct research on the psychology and neuroscience of addictions, focusing primarily on alcohol and cannabis use disorders and their comorbidity with major mental illness. Lana Vedalago is a first-year master's student in the neuroscience graduate program at McMaster and is supervised by Dr. Emlung. Before starting her program, she was employed as a research assistant in the Peter Bohr Center. Her thesis focuses on impulsivity, addictions, and mental health concerns among a population of offenders within the Canadian Federal Correctional System. Please join me in welcoming Michael and Lana.
All right, thanks for coming out today. So my section is going to focus on hypersexuality, so its prevalence, some diagnostic criteria, and strategies for assessment and treatment in a clinical setting. So before we begin, I just want to let you guys know that electronic copies of our slides will be made available if you're interested in having a copy. And we're also happy to share any other readings or assessment tools if you're interested. So I'm going to start off with a definition of hypersexuality. So it's been characterized as a pattern of recurrent, intense, and excessive preoccupation with sexual fantasies, urges, and behavior that individuals struggle to control. Symptoms might include a high frequency of sexual activity, significant psychological distress or impairment, and adverse life events associated with this out-of-control sexual behavior. So these negative life consequences can include STIs and unplanned pregnancies, relationship conflict and dissolution, significant psychological distress such as diminished self-esteem, depressed mood, and anxiety, and in some cases legal violations if the individual is engaging in sex offending. So there's quite a wide variation in how hypersexuality is measured in the literature. So that means there's a wide variation in estimates of its prevalence. But generally, prevalence has been estimated to be between 3 and 6% in the general population. And a study in 2005 within psychiatric inpatients found a current prevalence rate of 4.4% and a lifetime prevalence rate of 4.9%. So because there's this large variability in how hypersexuality is measured, I'm just going to focus on 3 main conceptualizations of hypersexuality. So the first one's going to be the criteria proposed by the DSM-5 work group, the ICD-11 criteria, so the International Classification of Diseases criteria, and then the characterization of the disorder that's most commonly seen in the popular media, which is sex addiction. So starting with the proposed DSM-5 criteria, hypersexual disorder was considered for inclusion. It was ultimately rejected due to insufficient scientific evidence. So with that caveat, I'm just going to briefly kind of go over the proposed criteria. So it states that hypersexual disorder is characterized by recurrent and intense sexual fantasies, urges, and sexual behavior over a period of at least 6 months, with at least 4 of the following 5 criteria: excessive time spent in pursuit of or engaging in sexual behavior, engaging in these behaviors to alleviate dysphoric mood states, repetitively engaging in these behaviors in response to life stress, repetitive unsuccessful efforts to control this, and repetitively engaging in these behaviors while disregarding potential physical and emotional harm to self or others. And there must be clinically significant distress or impairment. These sexual fantasies, urges, and behaviors must not be caused by the acute effect of some type of substance or by an underlying condition, and the person must be at least 18 years or older to get a diagnosis. The work group also proposed subtypes of hypersexual disorder, including masturbation, pornography, etc., and they're just at the bottom there. So compulsive sexual behavior disorder was included in the 11th edition of the International Classification of Diseases with similar criteria to those proposed by the DSM-5 work group. And these state that within an extended period of time, so 6 months or more, The disorder is characterized by a persistent pattern of failure to control intense, repetitive sexual impulses or urges, resulting in repetitive sexual behavior, and it causes marked distress or significant impairment in personal, family, social, educational, occupational, or other important areas of functioning. And it's important to note that distress that's entirely related to moral judgments and disapproval about sexual impulses, urges, or behaviors that would not otherwise be considered pathological are not sufficient for diagnosis. So symptoms may include repetitive sexual activities becoming a central focus of the person's life to the point of neglecting health and personal care or other interests, activities, and responsibilities, numerous unsuccessful efforts to significantly reduce repetitive sexual behavior, and continued sexual behavior despite adverse consequences or deriving little or no satisfaction from it. So here it's important to note that just having a high frequency of sexual behavior is not sufficient for diagnosis. Individuals with high levels of sexual interest and behavior due to just a high sex drive, who don't exhibit impaired control over their sexual behavior and significant distress or impairment, should not be diagnosed with compulsive sexual behavior disorder. So next I'm going to be discussing sex addiction, which has been used pretty widely in the popular media, like this headline on Us Weekly about Tiger Woods a few years back. So hypersexual behavior, it does in fact have similarities to other addictions. So there's this recurrent failure to control of certain behavior and the continuation of this behavior despite significant negative consequences. But in the literature that I could find, there generally wasn't much support for the addiction model. So the American Association of Sexuality Educators, Counselors, and Therapists actually released a statement regarding their stance on sex addiction. And they said that they don't find sufficient empirical evidence to support the classification of sex addiction or porn addiction as a mental health disorder. And it's their position that linking problems related to sexual urges, thoughts, or behaviors to a porn or sexual addiction process cannot be advanced as a standard of practice for sexuality education, delivery, counseling, or therapy. So currently the literature doesn't really support the addiction model for hypersexuality. So moving on to comorbidity, co-occurring psychiatric and addictive disorders are quite common among those with hypersexuality. So it's associated with affect dysregulation, depression and anxiety, pathological gambling, impulsivity, and substance use disorder. And on substance use disorder, in fact, a number of studies have found that 25 to 33% of individuals with substance use disorders identified as having hypersexuality, and 29 to 63% of individuals with hypersexuality also had a substance use disorder. So there's evidence that hypersexuality commonly occurs alongside other mental health or addiction issues. In terms of assessment of hypersexuality, the most important part is a comprehensive clinical interview. So this should cover the history of the presenting problems. It should rule out underlying conditions such as mental health, medical, neurological conditions, so things like head trauma, hormonal issues, dementia, psychosis, manic states that might better explain the behavior. Psychosocial history and sexual history should be assessed, and substance use history and potential comorbid conditions like depression and anxiety should also be addressed. So the main instrument used clinically for screening is the Sexual Addiction Screening Test Revised. It's been used in criminal justice settings and treatment center settings. It can be found online if you're interested in taking a look. This one is made up of 45 yes or no items, and these items include: do you often find yourself preoccupied with sexual thoughts? Do you feel controlled by your sexual desire? Things like that. There are certain tests that are shorter and maybe more valuable in a kind of a quick clinical screening session, like the Hypersexual Behavior Inventory, which is an 8-item scale. And if you're interested, you can send me an email. I can send it over to you guys. So in terms of treatment, a lot of the literature supports taking a multifaceted approach using various modalities, and it should be tailored to the specific needs of the patient. Again, any co-occurring mental health or addiction issues should be addressed in treatment. Some current treatment strategies with some evidence of efficacy are CBT, motivational interviewing, psychodynamic therapy, individual, group, and couples therapy. There's also some limited evidence for pharmacological treatment used alongside these other treatment strategies. So there's a small body of evidence among male participants showing some effect of naltrexone, SSRIs like citalopram, and triptorelin, which is a drug used to treat prostate cancer. So a more local resource for treatment of hypersexuality is the Sexual Behaviors Clinic at CAMH in Toronto. They run a 12-session outpatient hypersexuality group for men, which is offered about 3 times a year. And they use some of these treatment strategies previously mentioned, like motivational interviewing, CBT, mindfulness, and coping strategies. So to wrap up, hypersexual behavior has recently been the focus of a lot of research interest and clinical attention, and there's still ongoing efforts to define it and develop diagnostic criteria. There's no one-size-fits-all treatment approach because of the heterogeneity of presentation and symptoms seen in hypersexuality. Generally, this field of research is still in its infancy and has quite a ways to go. So with that, I'm going to hand it over to Dr. Amlung, who's going to discuss internet gaming disorder.
Great, thank you, Lana. So what I'm going to be covering today is what's known as internet gaming disorder or gaming disorder. Originally, we were thinking about also covering internet addiction, but one of the challenges here is that the field of internet addiction is still very new, and there's very little agreement in the field among clinicians and scientists about whether or not internet addiction or social media addiction really should be kind of talked about in the same context as some of these other types of behaviors that really do lead to a disorder. And so it actually, to this date, has not even been considered for inclusion in the DSM yet. And so we're going to focus on internet gaming disorder because it does have a presence in the DSM-5 as well as the ICD-11. But one of the things that Lana and I can provide to you, if you're interested, is we have a textbook on behavioral addictions that we reviewed quite a bit for this presentation that I'd be happy to provide scanned PDFs of chapters from there. There's a chapter on internet addiction, a chapter on hypersexuality, a chapter on internet gaming disorder. And the book is not the most cheap book out there, so I'm happy to provide PDF scans if you would like to read a bit more about internet addiction and learn more about it, possibly to inform your practice. But just like Lana's presentation, we're going to talk about prevalence of internet gaming disorder, a little bit about assessment and treatment of this emerging disorder that kind of, again, has some parallels to classic substance use disorders. Before we go into what the DSM has to say and what research has to say, I think it's important to set the context about what we mean when we say online games. Because even for myself, when I started preparing this presentation, I don't play these sorts of games, so I didn't even know kind of what the landscape was like, what this market was like in terms of the entertainment value around it and how big the industry is. So it really started with what were called multi-user domains or dungeons, and you can see this is some screenshots of some, let's see, I guess even the game driver version there on the left is 2010, so these things are still used even as recently as 2010, 2009. Generally, these are text-based games where people can interact in these virtual worlds. They'll type commands in. You can see an example here on the right where they're entering a main dungeon and they type in what they want to do. People interact through servers on these games anywhere around the world. Things have evolved quite a bit to now what we call massively multiplayer online games, or you may have heard somebody referring to these as MMOs or MMOGs. These are things like World of Warcraft, Skyrim, Call of Duty is shown here. And you can see that the level of immersion and sophistication of the graphics and the environments here have evolved tremendously so that these are highly rich environments where people are engaged in this gameplay with people from all over the world. They're communicating in real time, playing these games, investing a lot of time and also a lot of money into these sorts of games. And some research has shown that these games share 6 technical design characteristics that I think are important to understand if we're going to talk about how this develops into a pathology. First of all, they require persistence. And so these games are the type where if you don't keep playing, bad outcomes can happen. So if you're in World of Warcraft and you don't keep playing, you lose points, you lose lives, you lose challenges, you lose quests. They're usually a physical nature, so there's usually some sort of battle or other sort of physical nature. They are what's called avatar-mediated play, so you are controlling a virtual avatar in this world, whatever the game may be. And that has some important implications when we talk about the social aspect of this, and we'll talk near the end about the potential for some interesting interpersonal and social dimensions, such as introversion and social anxiety, that may play into this. The next two here are called vertical gameplay and perpetuity. So what that means is that most of these games don't really have an endpoint. And so you can continue to play. There's always new challenges, new quests that the game developers are launching and other programmers are launching. And there really is no end to the game, which if you think about it from the standpoint of a reinforcement model, it will continue to reinforce the behavior. You can continue to keep going really into perpetuity as it implies. And there's also a very heavy social interaction component to many of these games. People are communicating in real time using headsets and microphones. They're interacting with people from all over the world playing these. So there is a very heavy social component as well. And it's interesting because some industry research that's been published suggests that gamers actually have clear preferences. So we talk in the area of addictions that people have, drugs of choice or substances of choice. Well, gamers have games of choice. So up to 79% of online gamers report that they have a clear preference for either type of game or a specific game that they play. So the question is, who are these people playing these games? And I think we can look at this from a variety of angles. We can say, how are they represented in sort of popular media and in Hollywood films? How are they represented in sort of actual real life? Well, in Hollywood, unfortunately, there's a lot of misconceptions about who these people are. So South Park famously had this episode where the 4 kids on South Park became obsessed with this. I'm guessing it's some variant of World of Warcraft, and they developed into this. You can see the person here on your left of the screen. Obviously not a very accurate representation of what this probably is like. One of my favorite shows, Big Bang Theory. If you watch the show, you know this is Penny. She's normally very attractive blonde, wants to be an actor, wants to be an actress, works as a waitress. And over the course of a couple weeks, she dissolves into what you see here, where she's got Cheetos in her hair, pizza. She's obsessed with this online game. So comical Hollywood representations are not very accurate about who these people actually are. In the real world, it looks something like this. And so these are very sophisticated pieces of equipment that people have set up. If you go to Canada Computers here in town, there's entire aisles for mouse and joystick and keyboards and monitors and headsets. I mean, it's a very big industry. People coming together and playing both in public areas like this, but also playing at home. Very sophisticated setups. None of these people look like the people you saw on the previous slide. It's also not a particularly linked to any one demographic. So this was some data from the Entertainment Software Association. Now this is looking at just video game use. It's not necessarily online gaming, but this was from data from 2018, and what they're showing is that the average female gamer is 36 years old, the average male is 32 years old, and 45% of registered gamers that buy these games or have these accounts are women. And you can see that, yes, the majority are under 18 or 18 to 35, but there's a sizable segment of the population, 36 and above, that are playing these games. And it seems to be fairly well balanced between men and women across the age range. It also is illustrated by the fact stories like this one. So pardon the one sort of bad word on this slide, if you will, but this was from a gaming magazine, and I actually saw this on a Twitter post as well. She's known as Grandma Gamer, and she is 76 years old, and she plays Skyrim, and apparently she's ruthless and is really, really good at the game. And there's video clips of her playing this, and she's talking about going for the headshots and going for the kill shots and all these other things. So it clearly is she talks about how it keeps her engaged, it allows her to she really likes the visual environment of it. So this is not just teenagers playing these games. It really is a large segment of the population. So how big is the industry? What are we up against? Well, we all know that for example, the alcohol and tobacco and drug industry is rather large. Well, it's the same here for online gaming. The global games market estimates 2.3 billion gamers will spend almost $140 billion in 2018 alone. And this data may be a little small on your screen, but this is from a focus group known as Newzoo. You can see about 2/3 of the way over is 2018, so there's our 140 billion. We're expected to reach 180 billion by 2021. And so it's a massive market. The industry is huge. It's also a certain competitive element. So this is known as the League of Legends Video Game World Championships. This particular one happened in Vegas. Thousands of people show up to watch this. There are professional gamers, there are amateur gamers, and millions of people stream this and participate in this online. And they also win tremendous amounts of money if you happen to be one of the professionals. So this is a massive industry. It's not just people sitting in their basements anymore. This is obviously the video game industry realized that this is a market that they can capitalize on, and they've put a lot of investment into it. And as you can see, it can be a very expensive hobby, or in some cases can develop into a profession. I'm not trying to say that the people that are sitting here in this arena have internet or online gaming disorder. I think they've figured out a way to be skilled at this and make money off of it and make a profession out of it. Some colleges and universities in the States are starting to add esports leagues as part of their athletic offerings. So again, they figured out a way that they can make money off of it as well. We're really looking more at individuals that are kind of up at the higher end of the continuum where we may be talking about disorder. So how do we define internet gaming disorder, getting into some of the actual content here? Well, just like with hypersexuality, there really is a lack of a true consensus definition in the field, and that makes things complicated in terms of understanding how we can do research on this and how we can move forward with screening and interventions. It's been defined either as a specific type of video game addiction, or a variant of internet addiction, or as an independent diagnosis. And there are camps of people in each of these three areas that have their stake in what they think this really is. But it's important to also emphasize what it's not. So the DSM work group mentioned, we'll get to the criteria in a moment, but they made some distinctions. It's not gambling-based internet sites, so online poker, sports betting, etc. Those would be under the domain of gambling disorder in the DSM. It's also not the use of internet for required activities at work or other professional activities. It does not include recreation or social internet use, and sexual internet sites are excluded from internet gaming disorder. Those would be more closely aligned with what you heard from Lana's presentation. In terms of the prevalence, what makes it difficult to estimate prevalence of internet gaming disorder is that there is not a standard definition. And so each study has their own slightly different definition or scale. And so it's a little hard to say how prevalent is this on a global scale. It does appear to be highest among individuals from Asian countries. Large sample studies from those countries report prevalence of under 10%. It does appear to be more common among male adolescents, particularly 12 to 20 years of age. There was a study that was done using the proposed DSM-5 criteria, and they found 8.4% of male adolescents and 4.5% of female adolescents. So it is more common in males, but in general appears to be less than 10%. And one of the issues with these studies is that there is not a consensus definition or consensus diagnostic criteria when many of these studies were being done. Most of the studies are also done in Asian countries, and so we have a lack of sort of global data, cross-cultural data to know what the prevalence of this is. So this was considered for inclusion in the DSM-5 by the Substance Use Disorder Work Group. They ultimately concluded that it belonged in Section 3, Conditions for Future Study. And in order to understand where they made that decision, I thought it was useful to just mention this editorial. The link to it there is at the bottom. So Nancy Petrie and O'Brien were two members of this work group. O'Brien was actually the chair of the work group, and they wrote an editorial in 2013 explaining their decision. And they essentially said that there's over 250 studies on this, but there's no standard diagnostic criteria, so information on prevalence, course, treatment, and biomarkers is inconclusive, and certainly not conclusive enough to put it into a standard of the level of a DSM-5 diagnosis. Studies are needed to identify the defining features of the condition, importantly including cross-cultural data and prevalence rates and epidemiological samples in countries around the world, and also to better understand its history and biological features. So there's a lot of research, 250 studies, but it's not consistent in terms of the methods and the diagnostic criteria. Nonetheless, these are the proposed criteria in DSM-5 Section 3. And it's important that they included these because hopefully this will guide more research and also give you a place to start from if you feel that your clients are struggling with this. So once again, it's a persistent and recurrent use of the internet to engage in games, often with other players, leading to clinically significant impairment or distress, 5 or more of the following within a 1-year period. Preoccupation with internet games, so they're thinking about gaming activity or anticipating playing, it becomes the dominant activity. And they do put this note in here, and this is verbatim from the DSM. It's distinct from internet gaming, or internet gambling. Has withdrawal symptoms when the internet gaming is taken away. It's irritability, anxiety, and sadness, but keep in mind these are not due to pharmacological withdrawal because we do not have a pharmacological substance on board. There is evidence that there is the development of tolerance, so in needing increasing amounts of time engaged in the games, unsuccessful attempts to control the participation in internet games, loss of interest in previous hobbies and entertainment as a result of playing online games. They've deceived family members, therapists, or other professionals regarding the amount of internet gaming. They use it as a way to escape or relieve a negative mood, such as feelings of helplessness, guilt, or anxiety. And it has jeopardized or lost significant relationships, jobs, or education or career opportunities because of participation. Similarly to the substance use disorder criteria, it can receive a mild, moderate, or severe rating, but they do not provide actual cutoffs for what those would be for internet gaming, whereas they do for substance use disorder. But just looking at these criteria, for those of you that are engaged in treatment of people with substance use disorder, there's a lot of parallels here to what we see with classic substance use disorder and gambling disorder. The ICD-11 took a more proactive approach and actually included it in their diagnostic categories. So it's in the category of disorders due to addictive behaviors. It's known as gaming disorder. And ICD does their text in paragraph form, so I've just provided it here. You have it on the printouts if you need it. It's characterized by a pattern of persistent or recurrent gaming behavior, impaired control over gaming, increased priority giving to gaming relative to other activities, and continuation or escalation despite negative consequences. But I've highlighted one thing here, which is an important distinction between ICD and the proposed DSM criteria. It says may be online or offline. So DSM is saying online gaming disorder, internet gaming disorder, whereas ICD is a bit more broad. They're saying any form of video game or digital gaming can be included. Another paragraph here, it says it's sufficient severity to result in significant impairment in personal, family, social, educational, or other important areas of functioning. It normally must be for 12 months to receive a diagnosis, but shorter periods, if it's particularly severe, can warrant a diagnosis of gaming disorder in the ICD-11. So this is highly controversial. So when ICD-11 announced they were going to include this, the field of addictions and also psychologists and people that work in media and technology raised a lot of alarms about this. This is from an editorial in PNAS from the US, a leading peer-reviewed journal. Says that adding video gaming to the list of recognized behavioral addictions could help millions in need, but it could also pathologize a normative behavior and create a new stigma. And the APA, American Psychological Association, Division 46, which is the Society for Media, Psychology, and Technology, came out in the same time. So this was introduced when it was introduced to ICD-11, which happened in summer of 2018. This division came out with the following quotes. They say, "We're concerned that the current research base is not sufficient for this disorder, and it may be more a product of moral panic than good science." So it's a pretty scathing comment from this division, and this was a consensus statement. They also expressed concern that a problematic diagnosis can cause harm by distracting clinicians from real problems and encourage treatments that remove a coping mechanism for stress without replacing them. So their argument is, perhaps people are engaging in this behavior as a way to cope with other concerns or other issues, and removing that is removing a potentially very valuable coping mechanism without offering any other replacement for these individuals. To their credit, the Society for Addiction Psychology, which is APA Division 50, wrote a response to this saying, "Just because it walks like a duck and quacks like a duck doesn't mean it's an addiction," was the title of the editorial, where a focus group from a division that I'm a member of I'm not a member of the focus group, but I am a member of the division, came together and said, we're going to support this being an ICD, but we also support the DSM's hesitation and say we need more research on this. So there is a bit of a debate here about whether we're just pathologizing a normal behavior and whether or not it's going to lead to harm. In terms of comorbidity, it's a bit of a challenge because we don't have definitive diagnoses of internet gaming disorder, but it does appear that one of the most common things is physical health conditions due to being sedative and playing these games long term. There's interesting studies looking at rates of carpal tunnel syndrome and other sort of joint disorders from playing online games constantly. There is some evidence that you have comorbidity with major depressive disorder, ADHD, and OCD, but only a limited number of studies have shown this. In terms of assessment, we want to provide you with some tools that you might consider using in your practice, and we can also provide these via email. So one is a self-report internet addiction test. We do use this in some of our research in the Boris Center. It has items like how often do you stay online longer than you intended? Do you snap, yell, or act annoyed at someone when they bother you when you're online? And they're rated from 0 to 5. Importantly, this is just internet use, and so it's not internet gaming specifically. So people have tried to improve on this by using more of an integrative approach, and one of those scales is the problematic online game scale, which we can provide a copy of if you'd like that. And in the appendix of the chapter that I'm referring to, there's a list of other measures, but their length and some of the psychometric properties. And so if you're interested in possibly having some of these for your practice, please get in touch with us, and we can at least provide that chapter and provide you a roadmap on how to access them. But what's important to note here is that a lot of these behaviors are things that we heard yesterday in our presentation. I heard from somebody who works from Coast, and she came up and talked to me about sometimes they get calls, and it's because there's a child or an adolescent that's playing excessive video games. Mom and dad try and stop that, or they try and cut off the internet, and the child will throw the keyboard across the room or throw the monitor across the room or become violent. So this actually it can be a real issue for people. And she was telling me a few just anecdotes of some of the things she's experienced even here in Hamilton. In terms of treatment, interestingly, the government of China a few years ago actually released a statement saying they believe this is an addiction in China and it's leading to a tremendous burden for youth in China. So they've actually set up a national treatment program for video game addiction in China. Just like with any addiction, there are specialized clinics that pop up all over. There's some in the States, some in South Korea and UK. I'm not aware of any specifically in Canada, but I didn't dig very deep to find out for certain. But just like many of these clinics, there's few details published in the academic literature. It's unclear whether they're evidence-based. In the case of hypersexual behavior, you have the CAMH program, the 12-week program, very heavily evidence-based. Would recommend that. I don't know if I would say the same about these programs. Some of them involve rigorous exercise and more of a boot camp kind of structure to kind of give people healthy alternatives to playing in games. One of the things that did come up a lot in the literature that we reviewed for this talk was these online support forums. So there are discussion boards for family members that you could encourage people to seek those out and engage with other people that are struggling with this. There's some efficacy for behavioral therapy, CBT, or motivational interviewing, but again, very limited in terms of rigorous protocol-based interventions. What does appear to be helpful, though, is talking about time management techniques that provide structure and regulate online gaming sessions. So just like with classic substance-based and other behavioral addictions, we know that one of the most powerful ways to help people to reduce their use is to provide substance-free alternative activities, so other things to occupy their time and to provide reinforcement that don't involve substances. Well, in this case, providing alternative activities that don't involve online gaming has been shown to be important and effective. Some of the authors also suggest that one of the reasons that some people engage in these games is due to underlying interpersonal challenges such as extroversion or social anxiety, so you should consider those possibly as part of your treatment. And I just put this on here mostly to parallel Lana's slides. There's very little evidence about pharmacotherapy. There was one study in, I believe this is in China, showing that bupropion actually reduces problem behavior and depression scores. and a sample of Chinese individuals that engage in problematic gaming. So that's what we have. Once again, we're more than happy to provide any resources to you. We're happy to also answer any questions you have. So thank you very much. Any questions?
Thank you, Michael and Lana.
Okay, so I'm just going to put my email up here. If you have the slides, it's on there, but my email is right here at the bottom of this. If you want any resources, please feel free to reach out to us.